If you are over 60 and your blood pressure stays around 150 every day, the biggest danger is not how you feel today. It is the quiet pressure being placed on your arteries, heart, brain, kidneys, and eyes day after day. One reading can be misleading, but a repeated pattern near 150 is not something to dismiss as stress, age, or normal for me. If senior health warnings like this help you protect your independence, subscribe now, because the most important mistake happens before many people even call their doctor. A top reading near 150 means the pressure rises too high every time your heart contracts. In current blood pressure categories, a top number of 140 or higher falls within stage 2 hypertension. That does not mean a heart attack or stroke is certain, and it does not mean an emergency is happening at this moment. It means the pattern deserves timely attention, even when you feel perfectly well. The word pattern is important because blood pressure naturally changes throughout the day. It can rise after physical activity, emotional stress, caffeine, pain, or a poor night of sleep. A single high reading taken while you are rushing does not tell the same story as repeated readings taken correctly while you are calm and seated. But when properly measured readings stay close to 150 every morning or evening, your body is living under extra pressure hour after hour. High blood pressure is easy to underestimate because it usually does not announce itself with pain. You may cook breakfast, drive to the store, climb the stairs, and enjoy time with your family without feeling anything unusual. Meanwhile, the force inside your blood vessels continues with every heartbeat. Think of healthy arteries as flexible tubes. They expand when the heart pumps and relax between beats. When blood pressure repeatedly runs high, the inner walls of those arteries absorb more force than they were designed to carry. Over time, the vessels can become stiffer and less able to respond smoothly. This creates a difficult cycle. Stiffer arteries offer more resistance, so the heart must push harder to move blood through them. That harder push creates more strain on the same system. The reading on your monitor is no longer just a number. It represents the workload being carried by your arteries and heart all day. This matters after 60 because arteries often lose some flexibility with age. But common does not mean harmless. A higher reading should not be dismissed simply because many older adults experience it. Age makes careful measurement and an individualized treatment plan more important, not less important. One common mistake is paying attention only to the lower number. Someone may see 150 over 78 and decide the reading is acceptable because 78 sounds normal. But either number can place a reading in a high category. For many older adults, the upper number becomes the main concern. The damage is usually gradual. Imagine a door hinge carrying slightly too much pressure every time it moves. Nothing dramatic happens on the first day. But after thousands of movements, the hinge becomes stiff, the frame begins to change, and the strain can no longer be ignored. Your heart experiences a similar burden when blood pressure remains high. The heart is a muscle, and a pressure near 150 makes it pump against greater resistance. A thickened heart muscle can become stiff and may not relax or fill as efficiently between beats. Over time, persistent high blood pressure increases the risk of heart disease, heart attack, and heart failure. The first change you notice may not be chest pain. It may be unusual breathlessness while carrying groceries, fatigue during a familiar walk, or needing more pauses while climbing stairs. Those symptoms can have many causes, so they do not prove that blood pressure has damaged the heart. But they should not automatically be blamed on aging, especially when home readings remain high. High pressure can also injure artery walls and create conditions in which fatty material collects more easily. If the arteries that feed the heart become narrowed or blocked, blood flow can fall, increasing the risk of angina or a heart attack. This is why saying, "I have had a reading of 150 for years, and I feel fine," answers the wrong question. The important question is not whether the pressure caused pain yesterday. The important question is how much silent strain your heart and arteries should be asked to carry tomorrow. The brain faces its own risk. It depends on a steady network of large arteries and tiny blood vessels. When pressure remains high, those vessels are repeatedly stressed. This increases the risk that a vessel could become blocked or break, which are the two basic pathways behind a stroke. Not everyone with a reading near 150 will have a stroke. The number is not a prediction of fate. It is a warning that one major and treatable risk factor is not well controlled. The challenge is that you can feel mentally sharp while the vascular risk is rising. Over longer periods, high blood pressure is also associated with damage to small vessels in the brain and a greater risk of cognitive decline. But protecting the blood vessels remains an important part of protecting the brain. There is also an emergency boundary that every senior and caregiver should know. A reading around 150 is serious, but it is not the usual threshold for a hypertensive crisis. If your pressure rises above 180 over 120, wait at least 1 minute and measure it again. If the second reading remains that high and you have chest pain, shortness of breath, back pain, numbness, weakness, a sudden vision change, or difficulty speaking, call emergency services immediately. Do not wait for the reading to fall by itself. Sudden facial drooping, weakness on one side, or trouble speaking can signal a stroke. Treat those symptoms as an emergency even if you never had time to measure your pressure. For most people living near 150, however, the danger is different. It is not one explosive moment today. It is accumulated strain over months and years. The kidneys are especially vulnerable because they filter your blood through a dense network of delicate vessels. They remove waste, balance fluid, and help regulate blood pressure. When high pressure damages those vessels, kidney function can gradually decline. Then, the body may retain more fluid and find it harder to control blood pressure. High blood pressure can damage the kidneys, and damaged kidneys can make blood pressure more difficult to manage. It becomes a two-way cycle. Early kidney disease may not produce a clear warning sign. There may be no pain and no obvious change in urination. A blood test that measures kidney function and a urine test that looks for protein can reveal information that symptoms cannot. Consider two people with the same daily reading. One assumes the number is simply part of getting older and never brings a home record to an appointment. The other confirms the pattern, reviews every medicine, and asks whether kidney function, blood sugar, and cholesterol should be checked. This becomes especially important if you already have diabetes, kidney disease, heart disease, or a history of stroke. Your target and treatment plan must be personalized, but repeated readings near 150 still deserve action. Never stop a prescribed blood pressure medicine because a few readings improve, and never double a dose because one reading is high. Both choices can create new problems, including pressure that drops too low. Bring the complete pattern to the clinician or pharmacist who can review it safely. High pressure can also affect the eyes. The retina at the back of each eye contains tiny blood vessels that are sensitive to long-term pressure. Persistent hypertension can damage them. In more advanced cases, vascular damage can threaten vision. The sensible response is not panic. It is connecting persistent high readings with regular medical and eye care. A sudden vision change accompanied by very high pressure, weakness, numbness, severe headache, chest pain, or trouble speaking belongs in the emergency category. Across the heart, brain, kidneys, and eyes, the shared problem is repeated stress on blood vessels. Controlling blood pressure is not about winning a contest with a monitor. It is about protecting the ordinary freedoms those organs make possible, including walking independently, thinking clearly, reading, driving, and staying out of the hospital. Before deciding what your readings mean, make sure they are accurate. Poor technique can produce an artificially high number and create unnecessary confusion. Good technique cannot make real hypertension disappear, but it can reveal your true pattern. For 30 minutes before measuring, avoid exercise, smoking, and caffeinated drinks. Empty your bladder. Then sit quietly for at least 5 minutes with your back supported, your feet flat on the floor. and your legs uncrossed. Place the cuff on bare skin rather than over a sleeve. Support your arm at the level of your heart. Do not talk while the machine is measuring. Use a validated upper arm monitor with a cuff that fits properly, because a cuff that is too small can produce a falsely high reading. Take two measurements about 1 minute apart and record both results. Your healthcare team may ask you to measure in the morning and evening for several days. Follow the schedule they recommend. Write down the time, the readings, and anything that may have affected them, such as pain, poor sleep, caffeine, or a missed dose. A reliable home record can tell a much clearer story than one reading in a clinic. Some people have higher readings around medical staff because they feel anxious. This is called white coat hypertension. Other people appear normal in the clinic, but run high at home. This is called masked hypertension. Home monitoring can help reveal both patterns. It also protects you from two opposite mistakes, ignoring a genuinely high average and reacting dangerously to one unusual result. If your monitor continues to show readings close to 150 after careful measurement, do not check again every 5 minutes in fear. Record the pattern and arrange a timely conversation with your healthcare professional. Another dangerous belief is that 150 is normal after a certain age. Systolic pressure often rises as arteries become stiffer. But a common problem is still a problem. Current guidance generally aims for blood pressure below 130/80 for adults, while clinicians adjust decisions according to medical history, medication tolerance, frailty, fall risk, and individual circumstances. An older adult who becomes dizzy when standing needs careful evaluation. A clinician may compare seated and standing readings, review hydration, and examine medications. Preventing falls matters, but repeated high pressure should not simply be ignored. The answer is to find a safe and personalized path toward better control. Two kinds of people often get into trouble. The first ignores every high reading because there are no symptoms. The second becomes so frightened by each result that they measure repeatedly, change pills without advice, or avoid normal activity. Neither response respects the pattern. Calm action sits in the middle. Measure accurately, keep a written record, review your medications, and create a plan with a qualified healthcare professional. Your age changes the conversation, but it does not make the number meaningless. When you arrange an appointment, do not say only that your pressure is sometimes high. Bring specific information. You can say, "My home upper readings have averaged close to 150 for the past 7 days, and I measured them after sitting quietly for 5 minutes." Bring your monitor if the clinic is willing to compare it with their equipment. Also bring every prescription, over-the-counter medicine, vitamin, and supplement, or prepare a complete list showing the dose and timing of each one. This matters because certain products can raise blood pressure or interfere with control. Decongestants, some anti-inflammatory pain relievers, stimulants, steroids, and certain herbal products may contribute. Do not stop a medicine on your own. Ask whether anything in your routine could be affecting your readings. Mention loud snoring, pauses in breathing during sleep, morning headaches, swelling, pain, ongoing stress, alcohol use, smoking, and missed doses. These details are not a confession. They are useful clues. Ask what blood pressure target is appropriate for you. Ask whether another condition could be raising the number, whether your kidney function or urine should be checked, whether your medicines are working throughout the entire day, and which side effects deserve attention. Current guidance supports medication treatment together with lifestyle changes for stage 2 hypertension. And many people need more than one medicine. The correct drugs, doses, and timing must come from a prescriber who knows your health history. The goal is not to produce one impressive reading before breakfast. It is to lower the average pressure safely so your organs experience less strain every day. Healthy habits remain important, but a repeated reading near 150 should not turn into a do-it-yourself experiment with garlic, herbal tea, supplements, or a few salt-free meals. Lifestyle changes support proper care. They do not replace an evaluation. Begin by becoming more aware of sodium. Much of the sodium people consume comes from packaged, restaurant, and processed foods, not only from the salt shaker. Soups, sauces, breads, deli meats, frozen meals, and snack foods can add up quickly. Eating more vegetables, fruits, beans, whole grains, nuts, and suitable low-fat dairy products can help many people manage blood pressure. However, kidney disease, diabetes, swallowing problems, and medication interactions can change what is appropriate. Personal guidance matters. Regular activity can also help. For many older adults, walking is a practical place to begin. If you experience chest pain, fainting, severe breathlessness, or major mobility problems, seek medical guidance before increasing the intensity. Sleep deserves attention as well. Loud snoring, choking or gasping at night, and strong daytime sleepiness can point towards sleep apnea, which is linked with blood pressure that is difficult to control. Addressing a sleep problem is not only about feeling rested, it may be an important part of the blood pressure plan. Limit alcohol, avoid tobacco, and find realistic ways to reduce ongoing stress. None of these steps is an instant cure. Their power comes from repetition, just as the damage from high pressure comes from repetition. Take prescribed medication consistently. If cost, side effects, complicated timing, or forgetfulness makes that difficult, tell your clinician or pharmacist. They may be able to simplify the plan. Staying silent can make an adherence problem look like treatment failure. If your pressure continues to stay near 150, follow a calm plan. First, confirm the pattern with correct technique. Use the right cuff, sit quietly, support your arm, take 2 readings, and write them down. Second, contact your healthcare professional promptly instead of waiting for symptoms. A repeated stage 2 pattern deserves attention even when you feel well. Third, prepare the full story. Bring your readings, medicines, supplements, sleep symptoms, recent health changes, and questions about your personal target. Fourth, continue taking your medicines exactly as prescribed unless your prescriber changes the plan. Never borrow another person's pill, double a dose, or stop treatment because the number temporarily improves. Fifth, remember the emergency boundary. If your reading rises above 180, over 120, repeat it after at least 1 minute. If it remains that high and you have chest pain, shortness of breath, back pain, numbness, weakness, a vision change, or trouble speaking, call emergency services immediately. If it remains that high without those symptoms, contact a healthcare professional as soon as possible. Finally, remember what a daily reading near 150 truly represents. It is not proof that disaster is coming, and it is not a reason to live in fear. It is an early warning that gives you time to act. The real victory is not forcing one reading down before breakfast. The victory is reducing the pressure your arteries, heart, brain, kidneys, and eyes must carry across thousands of heartbeats, so you can protect the ordinary freedoms that matter most. Know your pattern, bring it to the right person, and turn a silent number into a clear plan.